Hello, everybody. My name is Dr. Neena Vijayvergia. I'm a specialist in neuroendocrine tumors. And today I want to talk about something that's often underemphasized in neuroendocrine tumors, which is the importance of patient-physician communication and patient education. Because NETs are such a rare, indolent disease, how we talk to our patients is as important as how we prescribe and what we prescribe for their disease. We treat a biology and patients are uncertain about what this really means. And a clear communication framework is a very important therapeutic tool. People call it the net spiel. I have heard that people say that too. And I think it's very important. The importance of patient communication is really honed down to the fact that these patients are misdiagnosed for years. They've been told they have a lot of different other medical issues rather than having a neuroendocrine tumor. And by the time they come to us, they've looked at the internet forums, they've read partially accurate information and summaries and anecdotal experiences of people. So some is truth, some is half truth, some is miscommunication, misconceptions, etc. And then this actually provides us with the important background of the unmet need and how it's so important to educate the patients about this disease, all the nuances involved in treatment for this cancer, and evolving science too, right? For example, wait and watch is a very acceptable strategy for patients with advanced low volume disease, and especially in the low grade tumors. But now, if you don't educate the patient about the importance of it and how this is a marathon and not a sprint, it will lead to significant anxiety if you tell somebody you have cancer, but I'm going to just watch it, right? So very important to have that education and the communication piece included. As I just mentioned, the disease course of NETs is a long-term course. You have imaging every so often and for a long period of time. There are incremental changes, there are changing symptoms. There's many a times the side effects of treatments are more than the disease initially. And all of these are very important to ensure that we talk to patients about all of this. Now, there's been studies that have been done, right? And that specifically, patients repeatedly report that they have difficulty accessing information from trusted sources. It even found that many patients, even 6 months after the diagnosis, really report that they have poor information or decision making or involvement in the decision making process. Having said that, we do know that informing patients, education, incorporating patient-reported outcomes leads to better outcomes. Hence, it's way more important to listen to what patients have to say. And, in neuroendocrine tumors, what does education communication look like, right? I think important to set expectations with the patients, goal setting, right? Are we focusing on symptom control, tumor control, how both of them work together, but also maybe separate? How does each of these different treatment options work, and how sequencing is more an art than a science? Talking about localized therapies for the liver, right? If you have limited disease, talking about the long-term risks of some of the therapies like peptide receptor radionuclide therapy and why I wouldn't offer it to a low-grade tumor with low volume disease as a first step. So these are all important things that we need to talk to patients about. One important issue to talk about is also what kind of websites they should look for information, right? There's better portals, there's a lot of patient support groups, there's a lot of patient-facing websites that help patients. And these are very important in educating our patients and empowering them to make the right decision and work together in taking care of our patients. I think, as we push forward all the science we have in neuroendocrine tumors, it's the importance of educating the patients about all these therapies, the combinations, new theranostic approaches. You have targeted therapies that are coming out in this disease. These are all very important. And it is important for us to educate the patient so that they can make sense of it, to ensure that they are enthusiastic about these options with us and help us move the field forward as much as single. Enrollment on clinical trial is directly proportional to how we educate our patients. So all of these things are very, very important for our patients. So here, I hope I educated you all about the importance of educating our patients and having a frank communication with them, because that is the cornerstone of treatment. And I use it in my practice, and I hope we can all use it to empower our patients. Thank you.